Welcome to the Doctor's Podcast, Health Tips Weekly, Episode 15. Most asked questions regarding COVID-19 answered. Hello everyone, welcome back to another episode of the Doctor's Podcast, where we will be providing health tips weekly. This week, due to the high amount of queries received on our app and social media, we have compiled the 8 most asked questions regarding COVID-19 and have them answered by our doctors and pharmacists serving in the COVID task force on the Doctor's app. If you didn't know what COVID task force is, here's a little bit of context. COVID task force is an initiative done by doctors, and it is also being featured in my Sujatra app under digital health section. Under digital health section, we have recruited various healthcare professionals to answer each and every user's concern about their own health and the pandemic for free. Check it out now. Now, here's what you need to know. Question 1. I have visited red zone recently. Do I need to go for the test? No, you don't, unless you become symptomatic within 14 days. Question 2. My colleague's partner was just recently tested positive for COVID-19. What should I do? If your colleague has been in close contact with their partner in the last 14 days leading up to their partner testing positive for COVID-19, your colleague should take a COVID-19 test themselves and stay quarantined at home while they wait for their test result. In any case your colleague turned up for work and their test result was negative, there's nothing to worry about. However, if your colleague's COVID-19 test result comes out positive, the people who came in close contact with them should take a COVID-19 test and quarantine themselves at home while they wait for their own results to be released. Whoever that tests positive will be sent to Sungai Buloh Hospital immediately via an ambulance. Question 3. My family and I recently just came back from Sabah and currently no symptoms. Should we quarantine ourselves for 14 days? Yes, you must quarantine yourselves at home for 14 days. Upon arrival at the airport, a PCR swab test will be done on you. You will be given a home surveillance order and will be told to quarantine yourselves at home for 14 days. Question 4. I am a mother of 2 and currently breastfeeding. My symptomatic husband is recently being tested and is waiting for results. What should I do? Your entire family, including your husband, must quarantine yourselves at home while waiting for your husband's test result. If it comes out positive, the entire household will be required to do a COVID-19 test. Question 5. I have been having dry cough and sore throat for 1 week and not getting better. Question 5. I have been having dry cough and sore throat for 1 week and is not getting any better. Do I need to go for the test? Well, this depends on a few factors. Have you been in close contact with a positive case? Have you traveled overseas in the last 14 days? Have you traveled to a red zone areas? Or did you attend any mass gathering in the last 14 days? Question 6. I have completed risk assessment via my Sujatra app and was informed high risk. What should I do next? If you answer yes to any of the above questions, then you need to get yourself tested. Otherwise, stay indoors until your symptoms have dissipated. Then, take the My Sujatra risk assessment again, to which you should be low risk. If your symptoms are not easing, you should get yourself tested. Question 7. I was in close contact with someone who is COVID positive 5 days ago. I tested positive negative today. I tested COVID negative today. Do I still need to self-quarantine at home? Even if you tested negative for COVID or feel healthy, you should self-quarantine since symptoms may appear 2 to 14 days after exposure to the virus. Last question. If my neighbors are infected with COVID-19, do I need to do self-quarantine? If you're not in close contact with your neighbor, you don't have to self-isolate. However, maintain social distancing, wash your hands regularly, and wear face masks when in public. That's it for this episode of the most asked questions regarding COVID-19. We hope that it has helped to clear some worries you might have. If you have any further questions regarding COVID-19, do not hesitate to consult our COVID task force for advices in our app. A small effort in curbing the infection can make a big impact. Till then, stay safe and healthy.